Welcome back to Favor Healthcare Student Academy. We're going to demonstrate our skill, Peri Care or Perineal Care. So what are we going to look on these skills? Number one, let's start by knowing our suppliers. What are the things that you need to carry in the patient room when you want to do this skill? So what I tell students, you need to remember you need to have 5 towels. So those will be 4 small towels, 1, 2, 3, 4. So you have 4 small towels and 1 big towel. That makes them 5 towels. You need to have a pair of gloves because I like to carry my extra supplier. I have extra pair of gloves, and you need to have a barrier or a protector because we don't want to get our patient's bedding wet. So you have this. Then we're going to do private care. How are you going to wash? Definitely you need to have your water in the basin. This is my water in the basin. You need to have your soap with you. It's our soap, and this is our hand sanitizer. So once I'm ready, I have to remember all our pre-entrance steps, and then we start with them. So what are the critical steps with this skill? What can you miss? Then you will fail. Number one, remember when you're doing Peri Care, you must do front to back. That one, if you do the other way around, it's a fail. And you have to remember about the strokes. Very, very important. We have to know how you do our stroke. I tell my students always, get your washcloths. Go into 4 pieces. Like this, like this. So where is this edge? I tell students I like to have it on my palm. This edge on my palm here. So what do? My 4 remaining, then I want to do like this. I will use my 4, then I'll fold them like this. So I'm having this first leaflet. So when I'm done using, I fold it back, I use with my thumb, then I get the other one, then I use this same way, fold back, this way same, back, and back. So it needs a practice to know how you're gonna hold it. Because if you repeat the strokes, they will say you did not do the right thing. So it's very important to practice to know how you are going to hold those strokes. So let's get ready to go to our patient room. Come in. Good morning. My name is Vane. I'm your CNA today, and I'm gonna help you with Peri Care. Is that okay? So once I get in there, patient say it's okay. I'm gonna make sure my bed is locked. I'm gonna provide my privacy. I'm gonna raise the bed to my walking view because I don't want to break my back. If you're tall, you just need to just tell it, watch your belly button where it is. Just get the bed that way. And now before even I start doing anything, because this is a wet skill, I start with putting on my first pair of gloves before even I start touching my patient. Once I have my glove, I'm gonna go ahead. Now I'm preparing my patient, so getting my protector, I'm gonna expose. We say we only want to expose from the side. So we are exposing from the knee down, going up. So once I'm gonna expose, I'm gonna have my patient request my patient, please Jimmy, you're gonna help me to raise up your bottom for me in a count of 1, 2, 3. You're gonna move back. Because of privacy issue, what I've been telling my students, you see the same towel you have, just bring the towel and cover the patient. See, we only expose the part that we're going to take care of. So once I have this, our safety, what may be hot for you may be cold to someone, and what is cold may be hot. So I have to give the patient to check the water temperature. And now because it's the mannequin, you hand it over to the instructor, and the instructor will not validate and they will say, okay, the water is okay. So you need to make sure you don't use cold water. Use the water that you think it's warm and not hot. So what do? Take my first washcloth, I'm gonna wet it. And once I'm ready, students, please, don't take soap and put it in the basin. This water we're gonna use for wash, rinse. So only take your washcloth, make it wet, and squeeze it because we don't want to have, and don't squeeze too much, but we don't want to have it dropping water. Take my soap. I like to put at least in 2 strokes. Put enough soap. Just once I have it, I like to wrap the soap around my washcloth. I don't want all of it to soak. So what I do, go back 4 strokes, and this is where our skill is. Once I have it, now the instructor will be really watching you very keen on how you do it. So in the female part, we have the labia major, the labia minor, and what I do, I use my hand and I spray them. So I will start from cleaning inside first. Inside this corner, the other side, then I go outside. So we're gonna go with our first stroke. I want you to watch very keen, and I hope this video gonna be able to capture very well for all of you. For my first stroke, I'm gonna go in this part. Go all the way down, inside down. Then I open my stroke. Then I get another stroke. Then I go all the way inside, all the way down. Then I get another stroke. Now I'm doing outside part, all the way down here. Then the other side, outside, all the way down. We always say start from cleaning the in part, then you go outside, because you don't want to bring dirty germs from outside and bringing it inside. So our inside here, then if the camera please can view, zoom very well. I mean, when I say inside, these are our internally inside, and this is our outside part. First wash. Next, you want to make sure you have your laundry packet closer to you. I'm going to take my second washcloth. I'm going to rinse. The same protocol, the same procedure, different stroke, starting from cleaning in, then I come out, because we want to start cleaning from the area that is clean, then going to the area that is dirty. So I take my first washcloth like this, and now I'm starting from the inside all the way down. I open it up, then I come here, the other side of in, all the way down. Then now we're gonna go outside, all the way down, and this one all the way down. So once I'm done with rinsing, I'm gonna go next. I do pat to dry. So I'm gonna pat this. So I'm gonna ask my instructor, please, can you stand for me on the other side? Because you need somebody to do on the other side. Somebody to do on the other side, so that we can turn the patient. And for this skill, you're gonna do it on a mannequin, so you're not going to do it on a really human being. So definitely you need help. So Jimmy, you're gonna hug yourself. I'm gonna have my patient to hug themselves, because I don't want to break their arm when I'm turning them. So I'm gonna fold my leg this way. Then I count of 1, 2, 3. I'm gonna turn you, Jimmy. 1, 2, 3. When I have them this. Now I'm going to do my back, and remember it's front to back. Take your first washcloth, make it moist. Take your soap, put it over, wrap vigorously. So I'm gonna start with my first stroke. So what I like to do, I start with the middle. This is what I go. I come from the end, all the way going up, front to back. First washcloth, I fold the back. Now I come to the other side of the patch, like this, all the way up, fold back. I bring my last, and I do all the way back to the other side. And my last one, remember when I was cleaning the towel, I was coming all stuck, then I go all the way straight down. So once I'm done, same way I did with wash, remember wash with soap, and now I'm gonna rinse. So I'm going to rinse with no soap. It's my washcloth. I'm gonna go ahead, start the way I started, the middle all the way back, fold back, Then I do the parts, this side. Then I do another part, this side. And my last stroke. And I go straight down, put in my laundry basket. I'm gonna pat to dry. Don't wrap, just pat. Because the skin is very fragile and we don't want to break the skin. So once I'm done, the student usually kind of forget to remove it. Immediately before I tie my patient, I remove this, this goes to the trash, move it back, then I have my patient back. And I do positioning, thank you instructor. So I position my patient. You cover them, straighten up their bed, make sure they are very comfortable, positioned up. Move my privacy, give them the call light. This is your call light. In case you need anything, please let me know. Give them physically. I'm gonna lower my bed. So this skill is one of the skills that is possible mandatory. What do I mean? Because it ends with hand washing. Think about we were touching the privates. Even if we have gloves on, this skill we have to finish by doing hand washing. So I'm gonna carry all my supplies that I didn't use. I need to go to the trash. My soap and this. Tell me anything you like me to offer you. The patient says no. So I'll come with all this. And this goes to the trash. This soap goes back here. At the testing center, I want you to be very careful. They have a sink. We are making an assumption. This is our sink and this is the toilet. Never dump the water in the sink. Please make use of the commode that is there. That's the toilet. Don't get confused. Don't get them tricky you because there's a sink and they think this water looks clean that need to go there. So I'm gonna end this in the toilet. And there they have a sink that is there. So open the sink. The tap. Open the tap. Rinse your basin in the toilet. Rinse in the toilet. Don't even rinse and forget it and put it in that sink. Rinse in the toilet. Rinse in the toilet. And once you're done, get your paper towel. Make sure you dry your container completely inside. Once you dry inside, get another paper towel. You dry outside. They have a place called dirty area. They have labeled dirty designated area in the testing center. And make sure the container goes to the dirty area, of which I'm gonna say this is our dirty area down here. So I'm gonna put in that area and I'm gonna move it. So this is one of the skills that has to end with hand washing. But how do we remove our gloves? I'm gonna go like this, pinch, pull down, roll it under your palm, and shove it on your palm. Go 2 fingers from inside. This, then pull it out. So I'm making assumption this is the sink they have there. You need to know hand washing is tested out. What they're gonna test, the instructor gonna be watching how long are you gonna scrub your hands. So look at this. Once you are in the sink, make sure your clothes should not be touching around the sink there, where you're standing to wash your hand. And then what you're gonna do, open the water faucet. Check the temperature. Okay, this looks good. Wet your hands. Never contaminate yourself. By saying contamination, do not touch inside the sink at no point. So go by scoop. I like to go by scoop. Wet my hands. Put my sock and the wrap. At the moment you start wrapping is when they're gonna start counting. If you're gonna wrap for 20 seconds. So I tell students, you better overdo then underdo it, because that's a critical step. So I count 1 to number 25. 1, 2, 3, 4. While you are keeping your elbows, above and this. Don't touch in the sink. Your hands are not touching anywhere. Your clothes are not touching. 23, 24, 25. Remember your nails, fingernails there. Rub, 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 back. Now rinse. Keeping an eye, your hands should not touch in the sink. And once done, grab the paper towel, dry your hands, get another piece, dry, get the last piece, use it and close off the faucet and dump it in the trash. Do not contaminate yourself. And once you're done, check yourself. Did I miss something? Is there something I did not tell? If you remember something, correct yourself. And that makes the end of our skill for Peri Care.